You are listening to Reduce the Stigma, a CJ106 docu-series funded by the Community Radio Fund of Canada. This series aims to provide information on local services, bring to light the work of healthcare professionals, and most importantly, reduce the discrimination faced by people with direct lived experience with a mental illness.
Hello, my name is Jan Eck, and this is Reduce the Stigma. We hope that you find this series on mental health resources in the Westman region both informative and helpful. We are glad to present many issues of mental health and wellness, a topic that in the past that had long been discussed in hushed tones or suspicious whispers. Today it seems we are more open to talk about mental health. We want to talk about it because it is something that affects all of us. The more we talk about it, the more we can destigmatize what we had previously held as fearful, unknown, or something that other people went through. For someone who is suffering from a mental illness, talking about it might mean that some people are listening. It could mean that their concerns are being taken seriously, but it definitely means that they are not alone. Chances are you or someone you closely know currently lives with a mental illness. Yet despite an explosion of information in popular culture surrounding mental health, stigma remains a barrier to diagnosis, treatment, and community acceptance. By promoting resources that can help people, by discussing the nature of mental well-being, and by listening to the stories of people living directly with mental illness, we hope to demystify the experience and reduce the stigma against those suffering from very real medical conditions. In this episode, we will be talking about eating disorders. Disordered eating includes the more commonly known anorexia nervosa and bulimia, and perhaps people recognize binge eating as well. And we will be focusing on these throughout this episode. Therapists and advocates for eating disorder awareness emphasize the seriousness of this condition, as the effects on the physical body are pronounced, and risk for suicide and self-harm are very high. The mortality rate for those affected by eating disorders is the highest of all psychological conditions at 5%. The causes of eating disorders are described as a set of complex conditions. There are biological factors. Having been previously obese, for example, could make one susceptible to an ED or eating disorder. There are psychological factors that may put a person at risk, such as low self-esteem and body dissatisfaction, and these are closely related to social factors. Peer pressures to look, act, and behave like the crowd can cause a lot of children distress and possibly generate negative self-body image. Girls are far more affected by EDs than boys by 5 times. Young women approaching adulthood are 10 times more likely to develop an eating disorder than younger men. It is thought that peer pressure is the primary influence, but family teasing about child's weight predicts an eating disorder by 1.5 times. Bullying or teasing at school and at home leads some to dieting, and some girls associate dieting with reduced food intake. Dieting, especially extreme or fad diets, are also predictors for an ED within 5 years. It was previously thought that disordered eating was a Western phenomenon. Prevalence remains much higher. Non-Western regions of the world are seeing increased rates. Bulimia, for example, in Western countries ranges from 0.3 to 7.3%, while in non-Western countries those rates range from 0.46 to 3.2%. It is thought that this increase in non-Western rates are a result of globalization, the increasing influence of media, and the westernization of values, including diet and nutritional sources, as well as the idealization of certain body types. Boys and young men are very much affected by these same trends. However, the desired changes are usually more of a more muscular mass. One indicator of an eating disorder is a reliance on protein milkshakes to maintain mass to attain nutritional requirements. Because of the physically threatening nature of anorexia or bulimia, treatment is especially urgent. Most often, intervention occurs early, and there's a spectrum of service providers. Most commonly, we find outpatient services to support recovery, which includes individual and group therapy and nutritional counseling, and there is also more intensive outpatient services depending on the level of care required. Sometimes hospitalization is required to resuscitate a nutritionally deprived body. A stay in a hospital may last 3 weeks or so, and usually a patient is afterwards discharged into residential care facilities. In this episode, we will be learning about the Westwind Eating Disorder Recovery Center, the private residential care program owned and operated by Westwind Counseling in Brandon, Manitoba, specializing in the treatment of anorexia, bulimia, and binge eating. The residential care at Westwind allows clients a higher level of care in a home environment. Stays at Westwind average 12 weeks, and a collaborative approach to treatment is highly individualized to attain specific goals and address core factors of the problem. I asked Teresa Clemenson, Director of Westwind Counseling, to tell us about the residential care services available at the Recovery Center and to help us learn a little bit more about treating disordered eating conditions. All right, let's start with a brief introduction. Your name and position with Westwind Counseling.
Okay, my name is Teresa Clemenson, and I'm a counselor as well as one of the directors at Westwind Counseling, so do the business side of thing as well as see individual clients.
Now, could you tell us do you have any pertinent education or training, and what led you to working with Westwind Counseling?
I have my Bachelor's of Arts from Brandon University and then my Master's of Counseling Psychology from the University of Calgary. I did my undergraduate thesis in media and body image, so it gave me an interest in this field, and so in my Master's I specialized in this field, and then when we moved back to Brandon, my husband and I applied at Westwind.
Okay, in this section, we'll briefly provide an overview of Westwind Counseling's status, basically, as an organization. Can you tell us the status of the organization? Is it private?
It's a private organization. It was actually founded in 1998 by Brian Gustel, and it started as a 5-bed residential program. It had expanded 5 years later to an 8-bed residential program, and we're actually now back down to a 5-bed residential program. But it is for profit.
Who are the clients of Westwind Counseling? Is it a diverse demographic?
So our clients who attend our residential program have to be 18 or older because it is an independent setting and we don't have staff overnight, so we do require them to be independent. Our clientele comes from all over Canada as well as the States and internationally. So we've had clients from in terms of England, Australia, New Zealand, as well as, like I said, the States and Canada. With our online program, we're able to also see males as well as females, but our residential program is female only. We also see clients in the community, so we can see males as well as females, as well as younger clientele. Our clients they attend sessions here.
So just a little bit more on that. How do people find out about your services?
Most of our services are found in terms of self-referral. So a great source for us is actually the internet. So if someone is searching for treatment, they typically will find us through an internet search. They will also at times be referred by their physician or their individual counselor wherever they're located. So we have lots of referrals from like Calgary, in terms of Toronto, and so we will talk to the therapist. But it is self-referral. So the clients do come because they're wanting to be here, and typically they're finding us themselves. We do some local advertising, so we do have a bus stop. You're right by Tim Hortons, so we thought that would be an excellent spot, and there's lots of people. So we have a bus stop for our individual counseling services. When this clinic was founded in 1998 by Brian Gustel, it was solely a residential program. When myself and Valerie Bittner took over 3 years ago, we really expanded the services to include an online component, as well as doing much more counseling in the community. So not only do we see clients in the community for eating disorders, but we also see clients who are struggling with self-esteem issues, body image issues, depression, and anxiety.
Specifically, what physical and emotional suffering are they seeking help and relief from?
So our clients who are struggling with eating disorders, definitely the eating disorder interferes physically, emotionally, and has many negative impacts in their life. And they are seeking treatment because they want change. An eating disorder is certainly not a choice. Nobody chooses to have an eating disorder, but a client has to be ready to choose recovery. And when they're seeking us out, they're at the place where they're choosing recovery. An eating disorder is a devastating illness, and it has many negative consequences, such as the physical, and that's with whether someone's dealing with anorexia or binge eating or bulimia, and it also has many emotional tolls as well, including things like depression, anxiety, low self-esteem, negative body image. It can interfere with things like schooling, work, personal relationships, and just overall quality of life.
What parameters define an eating disorder?
So typically the media, as well as a large percentage of the population, when they think of an eating disorder, they think of anorexia, and they think of an eating disorder as being a certain size. And an eating disorder is not a certain size. And for most people, you wouldn't be able to detect that they have an eating disorder. So when we think of like parameters, there's with each illness, whether it's anorexia, bulimia, binge eating disorder, there's certain in terms of diagnoses and symptoms with it, but they most of the time our clients, lots of the underlying symptoms are very similar. And so in terms of the parameters are actually very wide when it comes to diagnosing and identifying.
Can you help us understand the etiology or causes of eating disorders? Are there factors that would indicate a person at risk for an eating disorder?
So there, in terms of what precipitates an eating disorder, there is actually not like certain variables. There's a wide range, and it's an influence between environmental and biological. So there is factors that will predispose someone to an eating disorder. Again, an eating disorder is not a choice. A lot of clients have a lot of secrecy and shame around it because they feel like they've done something wrong to cause this. Again, it's environmental and influence of environmental factors as well as biology. Oftentimes but it's like the chicken and the egg in terms of like oftentimes the comorbid or depression and anxiety and low self-esteem, but those can come after the eating disorder, or it can precipitate it as well. There's things also like perfectionism, high achieving. There's lots of, like I said, other predisposing that can set the kind of stage for an eating disorder. Dieting, negative body image. But again, there's lots of people who experiment with things like dieting or have low body image or negative body image who do not develop an eating disorder. And again, it's because it's a predisposition towards it. So it's nobody's fault. Nobody is to blame for an eating disorder. Again, it's not a choice.
Are there warning signs of an eating disorder, and why are eating disorders so important to treat?
There certainly is warning signs for an eating disorder. It can be a change in eating patterns, a change in weight, a change in mood, increased isolation, withdrawal from activities someone would normally participate in. So those would be some of the kind of warning signals that there might be something going on. But oftentimes these are signals that whether it's a parent or a friend may not notice as a big red alarm or a red signal, and to the person who is struggling with these things, they're not likely to voice that they're struggling because they may not know that it is a struggle. We typically talk about the stages of change when it comes to treatment from Prochaska, and there's pre-contemplation, then contemplation, then preparation, then action for change. And so when an eating disorder first starts out, a client would be in the pre-contemplation. So they're not even recognizing that there is a problem. And so even if a parent recognizes that there's a problem, it's probably going to be denied by that young individual. As much as you can when there is those early warning signs, being able to provide not only education, but in terms of might be some sessions with a dietitian or a counselor to help bring more awareness to that individual that what they're dealing with is putting them at risk for an illness. Early detection as well as prevention would be great when it comes to eating disorders. Most times right now we're dealing with after diagnoses. But I mean, in terms of there's lots of campaigns now, whether it's with like Dove or Go Girls, more education being provided in the schools around body image and healthy relationships with food, which is all in terms of great preventative work, and there definitely needs to be a lot more preventative work. But typically, like in a center like us, we are dealing with more the after effects of like being diagnosed with an eating disorder. An eating disorder can be a very grave illness. Anorexia has the highest mortality rate out of any psychological disorder, through whether it's physical deterioration of the body, as well as a high suicidal rate for all eating disorders. Lots of our clients feel very hopeless with the outcome in terms of recovery, and it has such grave effects of and how it interferes in their life, that for some clients, suicide becomes what they feel is their only choice.
What kind of therapy is effective with eating disorders? Do you do both group and individual sessions?
We utilize evidence-based therapy, so our main mode of therapy with our clients is cognitive behavioral therapy, but we also use therapy such as acceptance commitment therapy and dialectical behavior therapy. And so we can take an eclectic approach through those three modes of therapy. Again, the evidence-based treatment for treatment outcomes rests heavily on the cognitive behavioral therapy for eating disorders. We do individual sessions as well as group sessions with our residential client, but we only offer the group sessions to our residential clients who are staying in our program. For clients in the community as well as online, it's solely individual therapy with either our master's level therapist or our registered dietitians.
You've introduced evidence-based therapy. Can you explain the concepts behind that?
Evidence-based therapy is therapy that is research-based, and so it's proven to be effective. All the therapy that we use here is evidence-based, so it's been scientifically tested and proven to be effective. We use a lot of Christopher Fairbairn's material, he's out of the UK and is considered kind of one of the experts in the field, and we are all trained by Christopher Fairbairn's approach and use that heavily in our program. Of course, we do work with our clients collaboratively, so if they know they've utilized a lot of cognitive behavioral therapy and it's really not the approach from them, then of course we'll utilize therapy that they can identify with. So maybe acceptance commitment therapy or dialectical behavior therapy is more therapy that works well with them, and so we can certainly change our approaches based upon what is most effective for the individual client as well.
What are the advantages of some of these approaches? Maybe you just pick one or two, like perhaps cognitive-based therapy. Maybe you could explain the advantages of CBT.
Advantages of CBT is helping clients to be able to identify their eating disorder thought patterns, to be able to then see what the distortion is in that thinking, and then reframe the thinking and choose more adaptive beliefs and thoughts, and then back it up with the behaviors that support those new cognitive patterns. So there's been a lot of work in the field of neuroplasticity and in terms of the rewiring our neural pathways, and so CBT also fits with rewiring our brain. But some of the other therapies as well, like acceptance commitment therapy and dialectical behavior therapy, also do similar things. So all three of those have added a big component of mindfulness, and so that's a big part of it, as well as starting to be mindful of our thoughts. We have thoughts, but we're not our thoughts, and learning to respond differently to our thinking patterns.
How successful are the therapeutic techniques that Westwind practices? Can you give us any stories of recovery that therapy is? You've seen a therapy make substantial improvement.
Well, we have had definitely in terms of many clients who have reached full recovery. When clients enter our residential program, they are at the place where they're really willing to make change, and so the readiness level is high. Recovery is a lot of hard work by each of our clients, and they're courageous and vulnerable and allow themselves to take on that work. When they leave here, there's often work that still needs to be done. So we do have maintenance programs as well that allows us to continue to connect with our clients to help them transition back to their home, into their living environment, and continue making recovery a priority. So we've had many successes, but it's also important to understand that recovery is a process. And so it's not just one linear step after another. It's kind of like we describe it as like a spiral process, and someone spirals towards full recovery. And so there is definitely, for most people, setbacks or slips that happen, but we help our clients learn to respond to those slips and setbacks, that, to do the next best thing when it comes to recovery. So definitely although it's a challenging process, recovery, it's a very rewarding process for the clients because they get their life back.
Does social stigma work against individual efforts to seek help?
Unfortunately, there is a lot of stigma and shame when it comes to eating disorders. I think in terms of it has improved, but for most individuals, they feel a lot of shame around the eating disorder, and secrecy breeds shame. And so a big part of recovery is starting for clients to be able to tell their story and to know that they struggle with an eating disorder, but they're not an eating disorder and it's not their fault. A lot of clients blame themselves or think that, they're a failure or something they've done wrong to evoke this. And again, I know I've said this, but it's not a choice and it's not something anybody chooses or can predict. So a big step in someone seeking treatment is overcoming their shame and being able to talk openly about it. So it takes a lot of courage to pick up the phone and to phone a treatment center or to counselor or your mom or your sister or a friend and say, I think I need help. Obviously, we want to encourage people to be able to do that because this is not a illness that you can fight alone. People need support to help them recover from an eating disorder. And once they take that step, they will get the evidence of, okay, I'm not being judged and this is okay. And then their supports start opening up and they can continue to take the steps in their recovery. But yes, there seems to be a lot of shame and secrecy, and we try and help clients understand it is like no one chooses cancer and nobody's shamed of cancer. And an eating disorder is also an illness. It's a psychological illness. No one chooses it, and it's not something that we want anyone to feel ashamed about.
Some mental illnesses, you'll find that the clients or the affected people face really severe discrimination in the workplace, in housing. Do people who have the direct lived experience with eating disorders face types of discrimination like that?
I don't know if and I mean, everybody is different, so I don't want to, everybody has different experiences. So in terms of, I don't want to talk on somebody else's experience, but generally speaking, a lot of people won't know somebody is struggling with this disorder. And so a lot of people struggle silently. They're still going to work. They're still doing, in terms of functioning in life, but they're struggling secretly. There seems to be more discrimination in terms of when someone is struggling with binge eating disorder or bulimia, who may be of average or above their natural set point weight. We still live in a culture that idealizes thinness and is openly discrimination with people who are various body types and sizes.
Okay, very good. How do social pressures and the media contribute to eating disorders? And we can bring concepts of self-stigmatization into that as well.
So in terms of from a young age, kids, males and females, are exposed to many, many pressures on what a female body and what a male body should look like, whether it's through advertisements, whether it may be modeled through siblings or parents or television shows, movies. And so we live in a culture where there's huge pressure to attain a certain body type. And this is not realistic. We're not all meant to be the same size, and we wouldn't expect to be the same height, but people expect that they need to be a certain size. We all have different natural set point ranges, and we need to respect body diversity. And so part of our treatment here is also education around challenging these cultural expectations of how we should look or how our body needs to look in order to accept it. So we work towards body acceptance and really challenging media's expectations. Now, with the socio-political context, there actually is, too, in terms of with what is considered the obesity epidemic, there has been a lot of push within the schools, even advertisements around what is good food, what is bad food, what our kids should look like. And although the intent is well intended, it can also affect people negatively as well. Then people learn like, oh, I can't have that because that's a bad food, or I can only eat this, or it's not okay to look like that. And so we have to be really kind of walking a fine line to, we want to be able to help support body diversity as well as legalizing what we refer to as legalizing foods. And so there's not this like that's off limits, because that kind of mentality oftentimes leads to the cycle of the eating disorder.
Can we talk a bit more about body image? I would like to know if there's anything that we could relate to our listeners, because I'm sure that there's so many people out there who do struggle with body image. It's a very common thing. Is there any specific advice you could give to people who are having a difficult time accepting their own body?
Body image is definitely something that we spend a lot of time on here, and we work towards helping clients accept body acceptance. We work from the model at Health at Every Size. Linda Bacon has an excellent book called Health at Every Size, and it really speaks to learning to value and appreciate our bodies and respect diversity. But oftentimes people think that in order to become satisfied or accept their body, that they need to change what it is that they think is the apparent defect, whether that's lose weight or change the way their nose looks. It's like, oh, I can only feel better if. We help clients to recognize it's not about changing your body, it's about changing the way we think about our body. So it's not our body that causes distress, actually, it's the way we're thinking about it. We can have two people who have the same body shape, size, height, and one can have really positive body image and the other person could have really negative body image. And that's because it's really not about what the actual body looks like, it's how we're thinking about the body. So we spend a lot of time through modes of therapy like CBT and ACT, learning to kind of retrain how we're thinking about bodies.
Is it also, what we think other people might be thinking as well about our bodies and body shapes? Is that something that we maybe need to let go of what other people might be perceiving? And also, like, there's so many different body types are admired. I mean, attracted. It's attracted to different people. Is that something that we should be promoting as well? It's like all different body shapes are attractive to diverse people. So.
A big part of working on body image is letting go of what we call control measures. And those are things like shape checking, which is things like looking in the mirror to see if you're okay, or things like comparison. And so that's when someone is looking at somebody else and kind of gauging where they measure up. Or also, like you had said, in terms of thinking about how other people are perceiving us. And we call that mind reading and fortune telling, because we actually don't know 98% of the time what other people are thinking of us, and most times they're not thinking anything of us because they're in their own thoughts. And so we have to work on attaching less importance to what we think other people may be thinking of us and focus on ourselves and working on reframing our own thoughts so that we can support a positive body image for ourselves.
Are there any groups, gathering, events, or days that mark awareness of eating disorders? Campaigns, for example?
So there is an Eating Disorder Awareness Week that happens every year in February, I believe it is. And so oftentimes during those weeks, we have a stand set up at the Brandon University and Assiniboine Community College just to promote awareness. We also, for our center, have a Facebook page and Twitter account. And so we're often promoting educational resources or good reading material to read around, things like prevention and recovery tools for eating disorders. And I mean, that's just our Facebook posts and Twitter are one resource. There's tons of excellent websites. NEDA has a website, that's the National Eating Disorder Association of Canada. And when you go on there, they have everything from treatment programs, therapists, resources for parents or family members who may be dealing with a son or daughter dealing with an eating disorder. So there's lots of great resources on the internet. There's lots of not so great resources on the internet as well, so we have to look at those with caution. But there's every year there's eating disorder conferences happening where therapists and doctors and physicians are attending, as well as community members. So there is lots of things happening within the eating disorder treatment world, and as much as we can, we're trying to share those with individuals in the community.
Oh, I did a great job of an overview of it. Do you think we've tackled each of these subjects efficiently?
To recognize for anybody who may think that they're struggling or know that they're struggling, that they're not alone, and to take the step in reaching out, whether it's telling a friend or your mom or phoning our center or anybody's center, to start the process of seeking help, because it is an illness that people can recover from, and that very hopeful to recover. And so it just takes that first step of reaching out and knowing that you're not alone in it.
All right. So how can one contact West Wind Counseling?
So West Wind Counseling, we have a toll-free number as well as our local number. Our local number is 204-728-2499. We also have a website that people can go on to, www.westwind.mb.ca, and it also has a option of emailing us and contacting us through the site. And it also has lots of helpful information about our center, as well as a couple of questionnaires that kind of help someone detect whether or not they feel that they are struggling with body image or an eating disorder or self-esteem. So whether it's through our telephone or our website or email, those are the best ways to get in touch with us. And we welcome all questions, and in terms of phone calls, and even if you just have a question about whether it's our services or about if you think somebody else is struggling, feel free to reach out, because we welcome it.
Thank you very much for this fascinating interview, Teresa Clemenson.
Thank you very much.
That was Teresa Clemenson, Director of West Wind Counseling, which operates the West Wind Eating Disorder Recovery Center here in Brandon, Manitoba. I hope that you found this episode on disordered eating informative and helpful. My name is Jan Eck, and you have been listening to Reduce the Stigma.
You are listening to Reduce the Stigma, CJ106 docu-series funded by Community Radio Fund of Canada, narrated by Jan Eck, produced by Jan Eck, Matthew Higgs, Tyler Addison, and Janice Brohl.